Obviously it's the Proton Congress in London, so I'm very interested to be here to meet other scientists and medical people and partners in proton beam therapy to obviously catch up and learn about some of the projects that are ongoing internationally and in the country. Yeah, particularly to sort of meet people and other colleagues. It's definitely a new practical thing for the UK, but proton beam therapies, the first treatments were in 1946. So it's been around for as long as LINAC-based radiotherapy, but the equipment's a lot bigger, more expensive, and so whereas there's something like 15,000 LINACs worldwide, there's only about 40 centres currently delivering protons. But in the early days, they were all based in physics laboratories that also treated. But in the last few years, there's been a big increase in centres going into hospitals around the world, which has been very positive. There's also been improvements in technology with pencil beam scanning, which is the new way of delivering protons, and also imaging on the machine. So actual cone beam CT allows you to image the patient when you're treating, which is something done in the radiotherapy world that is now being adopted in proton beam therapy. Another aspect is that the manufacturers develop single room solutions now, which could be a real game changer, because up till now you've had to buy two large centres with 2 or 3 treatment rooms, probably something like $150 million. But now, and that's a large amount of capital to put down just for a centre, whereas now a single room centre could be more like $30 million. Still quite a lot of money, but much more doable. And so for us at Proton Partners, that's really what we're looking to do, which is rather than just having one big centre located somewhere in the country, we're going to have multiple centres spread around the country to try and make to get more accessibility for people in the UK for proton beam therapy. So we're currently building in Newport and Northumberland and developing London, and then there'll be some more centres coming shortly. We're kind of opening in stages actually, so as well as the proton beam machine, we've got a LINAC as well, partly as a backup to the proton beam machine, but also to deliver radiotherapy on the LINAC. And some patients could benefit from both actually, so some patients might have some treatment on the LINAC and some on the proton machine. And we'll have chemotherapy as well, and again, some patients will have a mixture of chemotherapy and proton therapy. And the LINAC in fact is coming in about a week's time, so and we'll be starting that service at the end of this year. And then the proton beam hardware is coming to site at the end of November this year, and we want to start the clinical service at the end of next year, end of 2017. I think it'll be a really nice clinic. We've also got PET CT in Newport, which is an important equipment for diagnosis, but it also has some interesting applications for proton beam therapy, because after someone is treated with proton beam therapy, if you put them in a PET scanner, you can actually see where the treatment was, because the protons cause reactions where positrons are emitted, which are picked up by the PET scanner. And yeah, it'll be and that's one aspect really with again with proton beam. Historically, they've been separate centres to conventional radiotherapy. So one thing that's quite interesting is this opportunity of delivering treatments in combination. So and conventional radiotherapy has improved significantly in the past few years as well, with kind of rotational IMRT. And so there are some body sites that could really benefit from rotational IMRT, and then with a proton boost potentially. And considering at the moment the cost of proton beam therapy is higher, that gives the opportunity of making it available to more people. There are some treatment sites where it's already well recognised internationally that proton beam is the treatment of choice, particularly with children, young adults, and some adult base of brain. But I think in Europe certainly there's a feeling and there's some evidence that probably at least 10% of patients currently treated with radiotherapy would benefit from proton beam therapy. There's a few people speaking at the Congress. In fact, we heard earlier on, in Holland, they're developing 4 centres actually, and they're looking at basically a double planning patient. So a lot of radiotherapy patients will have a plan on the LINAC and a plan on the proton beam, and then they'll use the planning system to decide who should get proton beam therapy based on how the planning system calculates what might be the damage to normal healthy tissues, and that's across the board in terms of treatments. So not just limiting it to a certain number of treatments, because in fact I've heard Tony Lomax, who's speaking now, say that across every body site, depending on a patient's sort of individual anatomy, there will be some patients who would benefit from protons. And it's about making that available. So our intention at Proton Partners will be to double plan patients and so that we can decide based on that patient's particular situation and particular anatomy if they would benefit from protons or would get an equally good treatment on the LINAC. One other aspect, I guess, about protons in terms of the uptake, I mean, there's a big increase at the moment in the number of centres that are starting, and that will probably almost certainly have an effect on making the treatment cheaper. But also, there were some people are looking at the number of fractions, number of treatment sessions that patients get. So potentially reducing the number of treatment sessions on the proton machine, because it can be very highly targeted, especially now with imaging. So you could potentially then reduce the number of treatment sessions people have, and that will reduce the cost significantly.